Where wrinkles happen is in the dermis. You have to cause trauma into the dermis to make new collagen. I just feel like people get sold into a lot of procedures. The results are so mild and they're spending so much money. That's why, again, I do think it's nice to go to see a board certified dermatologist. We'll get people that have never had anything done. They're like, I've never had Botox and I'm nervous. No one can really hurt you with Botox. It can like look bad, like you have a weird eyebrow. But like some patients that are nervous will come to us for their first few treatments and then they go to
Right.
like the med spa because it's a little bit cheaper and they're spending way more than they would be spending with us. We're able to get away with a lot more subtlety and like less units. Anytime you take your epidermis away, the skin looks shinier, it looks brighter. It's just, you're not really getting into where collagen is being built. Like treat what bothers you because when you're spending money, you're not going to notice big differences if you're not treating what actually bothers you. Now, I'm also
Right.
happy to weigh in and say, like, this discoloration bothers you, but what you're not realizing also is there's texture change because when the collagen thins in the neck and chest, you get this like chicken skin appearance. We can treat the discoloration, but you're going to end up with this texture change that you're still going to notice. Let's do resurfacing laser, but we can grow new collagen there. It'll be smoother because you don't have this bumpy dimpling that you were going to have. Let's make like a long-term plan. Sometimes it's like, yeah, every few years we can do a laser. Let's do your Botox every, 4 months. Then as people get older, maybe it's different. Or if we're playing catch up, that's always a little bit harder. It'll be interesting to see what this next generation is like because they've already been so invested in skincare from an early age.